I'm here as your Member of Parliament, although I happen to be a Minister in the Department of Health. I'm not here as a Health Minister, so I'm not going to address some of the national issues that have been raised, because I don't think that's relevant specifically to this meeting. And I'll just explain. Somebody asked me about whether I was representing Westminster here or here at Westminster, which is a sort of classic question put to MPs. In this case, as a Minister in the Department of Health, issues that relate to Shropshire are taken away from my list of responsibilities that were read out by the gentleman at the back. I don't have responsibility for what happens here in Shropshire. What I do have is access, not in relation to my role as Minister of Health, because that comes under the Ministerial Code, it's very clear-cut, you don't have that responsibility. What I do have is access to the leadership of the National Health Service and the political leadership, and that gives me the ability to express views on behalf of people in Shropshire in a way that is somewhat better than were I not in the Department of Health in relation to this. So I have some ability to understand what's going on. I have some discrete influence, but I don't have any decision-making responsibility. I hope that is clear. In relation to the point of this meeting, which I think was prompted by the CCG review and the comments made by the two doctors present about the extent to which they felt the information contained in that review was erroneous and inappropriate. When I saw the initial, well, first of all, there are various reviews going on nationally. There's a review on maternity services going on nationally, and the review, as part of the current CCG review, is part of a national review of local maternity services, which is taking place in all 44 areas of the country that have been divided up by the NHS. And at heart, the purpose for that is to try to meet the aspiration to reduce the level of stillbirth, maternal death, and death through the process of pregnancy, ante and postnatal, perinatal death, which goes on is counted for a year after birth. And there's an ambition to halve that rate of tragedy until 2030, and we are doing well so far in meeting, heading towards that target. That's what this is about. So when people talk about the high degree of high-risk mothers presenting as high risk, this is not some convenience for the NHS. This is about trying to improve the life chances of the babies and of the mothers who all too sadly sometimes lose, and too frequently lose their babies. So I absolutely dismiss that assertion that mothers are being compelled to go to consultant-led units. It's in the interests of the patient and the baby. But these reviews are going on through the CCG for looking at how the CCG should best provide most equitably, with the resources that it has, healthcare across the community. And I'm appalled to hear that there are errors in the report which have survived the comments made by the doctors here in Ludlow, and that's something that I took up when it was first brought to my attention with the CCG leadership, and they told me that they agreed that the initial draft of the report wasn't good and that they would get it redone. And so I'm disturbed to learn that there are still errors in that report. The report, as I understand it, is a review. It has no recommendations, it has no proposals. And somebody asked what happens next. The lady over here asked what happens next. What happens next with that review is that, first of all, I will raise, as I'm sure others will, but I will raise the question of the potential inaccuracy of the document with the CCG leadership. It goes to the CCG leadership at some point between now and Christmas with a view to making proposals which will come out at some stage during the first quarter of next year, and those proposals will then be, if they propose significant service change, they will be subject to a full public consultation with CCG and local residents and everybody who has an interest in it, and I would ensure everyone here will take part in that. I do think, by the way, that there is, I hear what you say, Mr. Mayor, about not having people here from the CCG, but we've heard some very powerful testimony from some very brave people here today, and I think it is very disappointing that the CCG were not allowed to come to listen to this tonight, because their review, they're consulting on, which finishes tomorrow, so this exercise could have formed part of that review process, and it's disappointing that they're not here to hear it, because they were not allowed to be here. In relation to some of the other risks and perceived threats to the services that are currently taking place at the hospital, I'll mention a couple. The comment was made that we are losing our district nurses from Ludlow. I spent 2 hours at the hospital today, and I'd like to put this, I was told by the new and very excellent clinical services manager who's just taken over this Monday both Ludlow and Bishop's Castle hospitals, and she's very well rooted. She's moved here from a more high-powered job elsewhere, but her family are based here, and she wants to bring up her family here. So I think we've got her for the duration, which is excellent. She's made it very clear to me that the district nursing team, which comprises 10 district nurses plus support that are based in Ludlow, and the 12 district nurses and healthcare support workers plus other support based in Craven Arms, are combining to be based in Craven Arms, but they will not be, the way that by putting the two together so that they will have a single administrative base, it will give them more time to spend face-to-face with local residents wherever the residents happen to be. So they believe that this will have more capacity for local residents in Ludlow. And while the administrative base is moving to Craven Arms, the administrative base for the health visitors who are currently in Craven Arms is moving to Ludlow. So we will have the health visitors who are presently starting their shifts in Craven Arms, starting in Ludlow, and they're going to be integrated with the school nursing team to provide a more joined-up service for health visitors and for the young children that they are primarily looking after. So this is not. I think one needs to be very careful and cautious about sort of decrying every change in the health service as automatically leading to cuts, because it's not actually correct. Well, I'm just telling you how it's going to work and what I've been told about. As to the critical issue of beds in the community hospitals, and Peter Caulfield gave us a history lesson of what's happened in Shropshire going back several decades, and he's right that the number of beds have reduced in the community hospitals. And he's also right, the gentleman who talked about coming from Devon, I think, where Peter Gillard was talking about reductions elsewhere in the country. The reason why bed numbers have been coming down steadily is because length of stay in beds has been coming down quite radically over a period of time. And given the increasing demands on our health service, and the need to encourage people to stay living independently at home for as long as possible, I regret to say that staying in bed for a prolonged period once you're over a certain age in hospital reduces your chances of returning to independent living at home significantly. So it's in people's health interest to be looked after at home as long as possible. Clearly, the case that was made of the lady, the lady whose mother has vascular dementia, is not the kind of case that one wants to hear, and that one would hope would have an appropriate residential or nursing care found for her in due course. And I'd be very happy to take individual cases like that up if people want to write to me about specific cases. But generally speaking, it is the ambition of the health service in Shropshire to treat as many people as close to home as possible. And going back to the comment that was made about the objectives of Future Fit when it started, my understanding is that it remains absolutely predicated on, in terms of the acute services reconfiguration, on getting capacity into the community in order to allow the changes that they want to make by combining the acute services onto a single site. It cannot happen unless there are more services in the community. So some gentlemen referred to the 16% reduction in nursing beds, I think it might have been Pete again, proposed in Future Fit. Well, what is also proposed in Future Fit is that there's an 18% reduction in acute admissions by treating people in the community. So, in fact, the intent is to have more cases treated in the community than the equivalent reduction in nursing numbers, if that is the case. I haven't seen that figure in Future Fit. And we are going to treat people, Jill, increasingly in settings closer to home. So that means a variety of settings. That means at one extreme, people getting advice and treatment using technology. That means over the telephone. That means downloading their apps. Well, you may laugh, and many people may not appreciate that there are occasions when patients turn up to a medical setting, and what they're looking for is advice that could easily be given by a doctor down a telephone line or across an app. And we're seeing these technologies emerging very regularly and rapidly, and they haven't got to here yet, but they will come. There are other settings. Pharmacies can do much more than they do at the moment. GP surgeries can do more than they do at the moment if they're properly resourced. The question was raised...
Excuse me, Philip. Please have the courtesy, even if you disagree intensely, with letting the MP make his points.
I won't be much longer. Bishop's Castle Community Hospital was mentioned as having closed. It has closed for a refurb of the floor, which has been completed and reopened today. While it was closed, the GP surgery took in 2/3 of the nurses working there to operate based in the GP surgery, providing care to people in the area, either at the GP surgery or at their homes, and there is work being done on the consequences of that that 3-month period, and the anecdotal evidence at the moment is that referrals to admissions to hospital were significantly reduced because people were treated, more people were treated more quickly in their home, and they didn't need the hospital admission. So I think we have to be open to doing things differently and not automatically leap to the barricades for every single potential change in service that is proposed by the system. To conclude, if I may, Tim, you started this session, I think quite properly, by referring to the two key features that almost everyone's concerns can be encapsulated with, and those are the needs of local residents and access to services. And that is absolutely at the heart of what I want to see for this community, that we have high quality health care and we have ready access to it. We already have certain, as you would expect, tertiary services have left the county because they've gone to be specialised in other parts of the West Midlands. What we risk in this county from a lack of decision-making, which I absolutely agree has blighted Shropshire for too many years, has been the gradual drip of services being moved elsewhere. What I want to see are more services brought more locally, and I have confidence that the plans within the leadership of Shropshire, which, although whatever you might think of them, are far better than the leaders we've had in the NHS in Shropshire in recent years in terms of being prepared to make decisions and to focus on these two issues of needs and access, that we will get more services here. I was one of those who helped campaign with many others in the room, I'm sure, to get the renal dialysis unit here in Ludlow. It's been a fantastic, life-saving, life-changing set of services to provide to local people here across the larger regions, not just about Ludlow, as other people have said. I want to see more things here. A gentleman talked about his cancer treatment in Wolverhampton. I want to see cancer consultations here in Ludlow. I don't see any reason why we can't do that if this Future Fit proceeds. I'm not sure that we will get robotic treatments here in Ludlow, and frankly, getting it done in Wolverhampton is probably the best thing that could have happened to you. A, it's not that far away, and B, they've got a real specialisation in it. But I know that Future Fit is designed to put more services into the community. It's absolutely vital that we retain facilities here in Ludlow because of the challenges posed by access and need. I am very pleased to support efforts to do that, but I'm going to do so from a position of wearing my other hat as a health minister, helping to argue the case from behind the scenes, and I'm not going to be able to lead a march as I did 10 years ago to save the hospital, because A, I don't think the hospital is at risk. I think some of the services are under review, but I do not believe that Ludlow Hospital is going to close. Thank you.